Good afternoon, and thank you everybody for joining us in this powerful and educational Lunch and Learn, which is brought to you by family partners of Morris and Sussex counties. My name is Patricia Houston, and today is joining me Dr. Koss from the New Jersey Psychiatric Association. Welcome, Dr. Koss.
Thank you for including me in your Lunch and Learn.
Thank you. For us, it's definitely an honor having you in here. And the goal for this Lunch and Learn is to provide information to families and providers about resources and services available in the community. Dr. Koss, you're more than welcome to take the lead. And if it's possible, would you please tell us a little bit about yourself before you jump into the actual presentation? And finally, I also want to remind everybody that at the end, you can ask any questions. That part is not going to be recorded. And without further ado, I'm going to pass on this presentation to Dr. Koss. Welcome, Dr. Koss.
Thank you so much. I'm happy to be here with your community today. I'm a physician specializing in child and adolescent psychiatry, and I'm especially connected to your group as I both have lived and worked in Sussex County for over 25 years. So I feel a strong sense of connection to your mission and all that your team does. I'm also connected with the New Jersey Psychiatric Association and as a project manager for the New Jersey Pediatric Psychiatry Collaborative. I'm excited to bring you this information today. I understand we have a mixed audience, both providers and parents. I think you'll find this information useful in all of those roles. I hope it helps you in the work that you do on behalf of children. And I hope that you'll help me to spread the word throughout Sussex County as well. With that, I'm going to share screen. I do have some slides prepared that will lead us through our discussion. Can everyone see that?
Yes.
Excellent. Okay, well, here we go. And as Patricia mentioned, I will talk for a bit, but then save time for Q&A with our entire audience here this afternoon. My goal is to help you to understand the role of each member of the NJPPC team and also learn specifically what services are available through the NJPPC and how you can access those services. We'll start with a little bit of background information. And this is just to provide an introduction to the topic. I'm sure based on all of your experiences, you would agree with me that mental illness in children is common. We know that 1 in 5 youth experience a significant mental illness that interferes with day-to-day activities. And we know that through the last several years, we've seen a significant uptick in the level of anxiety, depression, and distress that young people are experiencing, so much so that we have heard from leaders in the American Academy of Pediatrics and the American Academy of Child and Adolescent Psychiatry that we're facing a national crisis. Our research helps to guide both diagnosis and treatment, and mental illness in children is diagnosable, and it's most definitely treatable. We have safe and effective treatments that include various forms of psychotherapy or talk therapy, medication management, family-based support, and school-based support as well. Early intervention is especially key. We know that half of all lifetime cases of mental illness begin by the age of 14, and 3/4 begin by the age of 24. The brain of a child or a teenager is still developing, probably goes on to develop through the age of 25. The earlier we're able to intervene with treatment, the better outcome for children. Unfortunately, families continue to remind us that there are many barriers to linking with care. Despite the growing awareness of mental illness as a brain-based illness, families continue to encounter stigma that leaves them feeling vulnerable in sharing their stories and asking for help. We still lack mental health parity. That is, insurance companies still are not treating mental health care the same way they're treating medical or surgical care. We've got a shortage of child child-trained mental health professionals across all disciplines. And we see transportation issues as well, as mental health specialty care services are being provided in certain hospital settings or centers of excellence. And we know that there are additional barriers for underserved populations. Children of color, our LGBTQ youth are experiencing greater levels of distress as they navigate current circumstances. We know that access to care is delayed because of these and other types of barriers. I'm sure you have stories to share that would reflect some of what the research shows. Average delays of 8 to 10 years from the time of symptom onset to the time of treatment intervention. This is critical time for growing children and teens. 1 in 4 parents tell us they can't access the specialized care that they need, and nearly 80% of youth who are diagnosed with mental illness don't receive treatment. This delay in treatment negatively impacts their outcome. Fortunately, we have a solution, and that is increasing families' ability to access mental health treatment through the collaborative care partnerships that exist between pediatricians, mental health clinicians, and child and adolescent psychiatry. And this is exactly the service that's provided through the New Jersey Pediatric Psychiatry Collaborative. So what exactly is the NJPPC? It's a regionalized system of psychiatric and behavioral health consultation teams that exist to assist pediatricians in managing their patients' mental health needs. The services are available for children up to 18 years of age and older if those older teens and young adults are still under the care of their pediatrician. The NJPP service is free for your child's, if your child is enrolled with a pediatrician, if your child is seeing a pediatrician who is enrolled in the NJPPC, excuse me. The NJPPC educates pediatricians about children's mental health care and helps them to screen patients for mental health concerns. Pediatricians who are participating in the NJPPC will be able to consult with a child and adolescent psychiatrist and the behavioral health care staff. Will be able to directly refer patients to the staff for intake and referral to other specialty care, and will also be able to access a one-time evaluation of their patients by a child and adolescent psychiatrist. There are a number of advantages to treatment through the NJPPC. We know that nearly every child has a pediatrician, and the families generally have a high level of trust in their pediatrician, and the pediatricians are very familiar with the history of their children and their families. Many families are also able to access services with a pediatrician who works in their community, and so services are more accessible. Transportation issues, less of a concern. Many families will also describe experiencing less stigma in a primary care setting. And through services, through the NJPPC, families will experience timely access to behavioral health care, timely consultation with a child and adolescent psychiatrist, and assistance with referrals to community mental health providers. So the NJPPC exists in 9 regional hubs throughout the state. And for those of you who have a cell phone with you at this point, you can use the QR code here to link directly to a page that will share, include some of the resources that I'm sharing with you here and provide additional information. Not to worry if you don't have a phone right now, I will also share the link at the end of the PowerPoint. But you'll see that the state is divided in 9 regions, and each region has a hospital or medical center that serves as the hub or home base. And it's at that office that the team resides and serves as a resource for pediatricians and families in the community. So for example, here in Sussex County, we're in this pink region, a region of the state that's specifically covered by the Atlantic Care Hub. And the services for the NJPPC are supported and provided through the contractors and subcontractors that you see listed on this chart as well. I've mentioned the NJPPC team. Let's spend a few minutes talking a little bit more about each of the individual team members. You see in this graphic that the team exists to support the patient and parent. The primary treatment relationship exists between the pediatrician and the patient. The NJPPC team, including the clinical navigator and the child and adolescent psychiatrist, are there to support the pediatrician and the patient and family. Clinical navigator is an essential part of the team. This is generally a social worker who brings their expertise and their knowledge in children's mental health, as well as their knowledge and experience of community mental health providers to treatment planning. And the child and adolescent psychiatrist is a physician specializing in child and adolescent health who brings their understanding of children's mental illness, child development, and specific treatment for children's mental health to the foreground. More about that in a few minutes. A little bit more background on the NJPPC, which was initiated in 2015. You'll see from some of the data here that the program's been well utilized. Since the inception of the program, over 18,000 children and teens have been referred, and 655 pediatric providers have been enrolled. A large majority, 70.5% of the referrals have been made to the team to assist with behavioral health treatment consultation. The pediatricians who have participated in this service have described great satisfaction in the support, education, and services they've received. Specifically, 83% of pediatricians have reported improved skills. And finally, psychiatric services, that individual consultation by the child and adolescent psychiatry, has occurred in 13.9% of the referrals that have been made. That is, 445 children have been evaluated. Well, let's look at this another way now. Let's take it step by step and understand what happens in the pediatrician's office, as well as what's going on at the hub. So at the pediatrician's office, the patient will present for a visit, and this might be an annual well visit, or it might be an appointment that was specifically requested by the family to address a mental or behavioral health concern. And in either of these cases, a mental health screening will be completed. This includes a standardized screening instrument, and I'll share more with you about that in just a moment. After that screening is completed, the pediatrician will then proceed by examining the patient, meeting with the parents, and reviewing the results of this screening. A mental health screening consists of a standardized set of questions that a child or a parent will answer in order to help the pediatrician identify early signs of a mental health disorder. There are a number of screening tools that can be utilized by a pediatrician, and the questions generally focus on areas of mood, thought, and behavior. The screening instrument is a first in a series of steps that will be completed by the family and the pediatrician in order to determine whether or not a more comprehensive mental health evaluation is needed and whether or not mental health treatment is needed. When a patient and family presents to the pediatrician's office, the front desk staff may provide them with the screening tools, or the nurse or medical assistant in the back office will provide the tool once the patient is in the examining room. Some offices will use a paper and pencil survey, and some will use electronics to share the tool. Once the patient and the family complete the screening instruments, the nurse or the medical assistant will score the instrument and share that information with the pediatrician. Any person in this sequence of events may trigger a referral to an NJPPC for consultation based on identifying a mental health concern. So if the mental health screen is positive, if the parent explicitly expresses a concern, if the patient explicitly expresses a concern, or if the pediatrician uncovers something in the course of the evaluation, any of these experiences could result in a referral to the NJPPC. There are certain steps that need to be taken by the pediatrician in order to make this referral, beginning with a conversation between the pediatrician and the family. The pediatrician will describe the NJPPC, much as I am with you today, and will describe why the referral would be helpful. The pediatrician will ask for consent from the family in order to share specific patient information with the hub. And the pediatrician lets the family know that someone from the hub will be calling the family for further information and for support. The pediatrician will schedule a follow-up appointment with the family so that they can circle back and learn about the interaction between family and hub and continue to oversee concerns. And the pediatrician will then complete a referral form and send that over to the NJPPC office. At the hub, we are going to focus next on the role of the clinical navigator, who again, as a social worker, will bring tremendous expertise to this process. The clinical navigator is the first to receive the NJPPC referral form for the pediatrician, and after reviewing the form, will contact the family to complete an intake. That is, to gather more information relevant to the area of concern. After carefully assessing all the information that they've been given, the clinical navigator will then make referrals to community mental health resources and will work directly with the family to ensure that those connections are made. As this process is completed, the clinical navigator will then report back to the pediatrician the specific recommendations, the specific actions that have been taken, and resources that will remain available to the family and pediatrician as they continue to work through the symptoms. The child and adolescent psychiatrist is also a critical member of the team and serves in a number of different roles. The child and adolescent psychiatrist can serve to provide a curbside consultation, as we often refer to, an informal consultation between pediatrician and child and adolescent psychiatrists. The pediatrician may call to ask information. How does depression present in an 8-year-old? What types of treatment options exist for a teenager with anxiety? In this type of curbside consultation, the pediatrician doesn't reveal any protected health information, but is learning more about the approach to diagnosis and treatment of children's mental health. And that information is taken back to the office and the team and really assists the pediatrician in their work with all of the patients in their practice. The pediatrician maintains treatment responsibility. The child psychiatrist is also available for systematic case review, that is, routine meetings with the clinical navigator, to review all of the referrals and the consultation requests that have come to the hub and to work together to determine appropriate next steps. The child psychiatrist is available for a one-time evaluation of the child. This occurs less frequently, but will occur in situations where the child is presenting with more complex issues and where questions remain about best treatment approach. Child and adolescent psychiatrists will meet with the child and family, generally via telehealth, and will then provide feedback to the family and pediatrician, either referring the child back to the pediatrician for care, or if a higher level of care or more specialized care is required, working with providers in the community. The child psychiatrist through the hub does not maintain treatment responsibility for the child. Child psychiatrist is also available to provide education for all team members, sharing presentations on relevant topics and reviewing best practices, treatment guidelines. And the child and adolescent psychiatrist provides leadership for the team, addressing any challenges that any team member may face. So you'll see that this is not a one-size-fits-all approach, that the treatment plan for each child is individualized to the needs of that child. And the treatment team may include the pediatrician or the NJPPC child and adolescent psychiatrist, a mental health clinician in the community, a child psychiatrist in the community, or other mental health providers all along the continuum of care. I'd like to take us through one more example, an example of a child to once again illustrate how the NJPPC works. Take the case of a 10-year-old girl who presents for evaluation of nonspecific stomach aches and headaches. The physical exam of this child is normal. Screening surveys that were completed by both the parent and the child reveal symptoms that are suggestive of both anxious and depressed mood. This prompts additional discussion between the pediatrician, the child, and the parents. And through this conversation, the pediatrician learns that the child has a history of separation anxiety dating back to kindergarten. And lately, the symptoms have resurfaced. This child has been reluctant to attend school, especially on Monday mornings, and reluctant to spend time with friends. The child reports that she fears something bad is going to happen to her family when she's away from them. And so she has difficulty upon separation, having difficulty being out of the home, even difficulty falling asleep at night, regularly co-sleeping with her mother. In this example, we can see how the services available to the NJPPC would be helpful to both the pediatrician and the family. The pediatrician can share introductory information about anxiety and how anxiety can be connected to both the physical and the behavioral symptoms that the child is experiencing. The pediatrician can describe the resources available to the family through the NJPPC, including referrals for cognitive behavior therapy, which is the form of talk therapy that's particularly useful and effective for children with anxiety. With the support of the family, the pediatrician can contact the hub, and the conversations that I've outlined in the previous slides can take place between clinical navigator and family. If medication is indicated for this particular student, the pediatrician can also consult with the child and adolescent psychiatrist, who can guide the pediatrician in choosing the right medication, choosing a starting dose, and learning how to monitor the child's response as the dose of the medication is adjusted. I hope that the information that I've shared is helpful for you, for our families in the audience, helpful to you as you advocate for your child, for the providers, as you continue to connect with other community providers. I hope you'll help to share this information, to bring this to staff at your schools, nurses, counselors, child study team members, and teachers, to share this information with other families in your school district through the FSO, through your PTOs, and to be sure that the NJPPC is included on lists of mental health referrals and resources in the community. And of course, to talk with your own pediatrician about the NJPPC. Let's work together to ensure and get to the place where we have all of our Sussex County pediatricians enrolled and actively participating in this program. I'll leave you with a couple of resources. You see here the actual link to that landing page connected to the QR code that I shared with you before, and also a person involved with the NJPPC who is physically located at Hackensack Meridian Hospital and can serve as a point of resource if you need additional information. And with that, formal presentation is complete, but I remain available for any questions from our attendees today.
Thank you very much, Dr. Koss. That information was very valuable, and I'm sure the providers attending this presentation, as well as the family, are going to benefit from this information, and also for the collaboration in doing this presentation, you know, the back and forth that it takes. So thank you very much for doing all of that. And with that, we are going to move to our Q&A session. Thank you very much, everybody, for being here. Thank you.